Yes, sir. So, sir, now we are live, so you can please start the session, sir. Please. Over to you, sir.
Okay, I am Dr. Hariharan from Vijayawada Polyclinic, and today my topic is on precautions for asthma and COPD patients during COVID-19. This is sponsored by CIPLA, Breathefree Patient Connect program. So I'm glad that CIPLA has organized this meeting at the hour of need. So participants and audience can ask me questions relevant to asthma and COPD and COVID at the same time. And am I audible? Hello? Hello?
Yes, sir, you are audible perfectly.
Yeah. Now I have a question by Honey. The question is how to reduce asthma. So okay. So how to reduce asthma? The best thing is always prevention. You should recognize what are the allergens you are having, like milk, pet animals, any clothing, any dust. So you should always wear a face mask, and should wash your hands properly and do not get exposed to dust and dirt, so that you can have avoidance of asthma. If you already have asthma, you can take some inhalers by consulting some physician or pulmonologist, and that is enough for you. And I have not seen any other question, so you can ask question. People are logging in, but they are not asking any questions. So if you want to ask anything, you can ask. Moderator, please ask questions. Yeah, there is a question from Srikanth. He has asked what is the precautions to be taken by asthma patients during this COVID time. Please explain. Okay, it is same as before. That means asthma patients, they should avoid dirt and dust, especially this COVID time. Should not go outside because asthma patients are easily prone to COVID infection. So you should wear a face mask, you should wear hand gloves, you should have a sanitizer all times, you should maintain social distancing. So there is no special precautions for asthma patients. You should always stay home. Should not get unnecessary exposure to crowd people. That's enough. Yeah, a question by Divya. She has asked that she is using Seroflo 250 but unable to reduce her cough. So, Divya, madam, you should use some anti-allergic tablets like Montelukast levocetirizine and tablets like Pulmoclear, that is ciprofloxacin with acetylcysteine, to reduce your cough. These two together, they can reduce your allergic cough. Okay, anyway, I'm typing the tablet's name so that the audience can note the names, the popular brand name. Okay, Archita has asked what kind of inhalers do we need to use. You should use a combination of bronchodilators, beta-1 agonistic, salbutamol, salmeterol, formoterol, and with steroids like budesonide, etc. For as in combination inhalers are also available in Rotacaps, Rotahaler, and other types of inhalers. Can allergic rhinitis turn into asthma in future? Yes. If your body is prone, if you have more eosinophilic counts, and if you are frequently exposed to dust and dirt, allergic rhinitis can turn into asthma. Both are components of allergy only. So, people of allergic rhinitis, atopic dermatitis, and asthma, they are one and the same. They have all allergic components. Next question. Meenakshi has asked a question. Uh, my child has having cold, so we need regular medication. No need. They should can take only during attack. Two inhalers. Inhalers during acute attack. Teja has asked a question. I am using Serapro 250 since 6 months, but at I feeling breathlessness sometimes. So it can be spasm. Uh, so it's better to meet one pulmonologist for changing of inhaler or contents of the inhaler. Johnson has asked for the prevention of uh, COVID infection. Can I use Budic or Totacaps? No, never use inhalers as a prevention for COVID. Johnson, don't use Budic for prevention. Prevention comes by face mask. With the face mask. Archita, avoid.
Doctor, you
Tell
don't
me.
have to type. Yeah, doctor, you don't have to type the answer. You can just say you can just talk the answer, sir. All right. You don't have to write the answer.
Class on. క్లాసులు ఆన్లైన్ క్లాస్ ఇండియా తొందరగా వింటున్నారు కూర్చోండి కొంచెం అటెన్షన్ లేదు నేను చెప్తాను అదే ముందు అడ్వాన్స్ పెట్టండి తర్వాత మాట వెళ్ళేటప్పుడు తగ్గిస్తాను లేదు వెళ్ళేటప్పుడు తగ్గిస్తాను ఇందాక చెప్పాగా ఇందాక ఏం చెప్పిందాక అమౌంట్ కట్టగలరంటే వెళ్ళే రోజు హలో
Hello, doctor. You don't have to write the answer. You can just speak. Okay.
Okay, next Bal. No, there's some will note down. Na? No, so no problem. Balkrishna.
They all are listening, sir. Your answers. Okay.
Balkrishna said asking how to diagnose asthma. So asthma is mostly clinical related. That means if you have allergic component and breathlessness, so we can diagnose and by with listening with stethoscope we can hear wheeze, that is a bronchoconstriction, and through spirometry, which is called a pulmonary function test. You should blow air into a spirometer, so you can pulmonary, there is machine called spirometry, which can diagnose asthma and COPD. So you should go for a pulmonologist where the machine is available. That is confirmatory test for asthma. Wheezingless and breathlessness can be symptoms of asthma. Vijay is asking. Yes, both are symptoms of asthma. Typically, Srilat is asking how much contact time needed for a particular person to get COVID. It is just 15 minutes. Teja, I am unable to run and feel tired after a little bit of a suggestion how to increase my lung capacity. Teja, you should practice using incentive spirometry. You will have three types of three pipes we have. In the three pipes, you will have three colored balls are there. You should blow it and blow in by reciprocating the incentive spirometry. So incentive spirometry costs around 200 to 300 rupees. Just it is available in every surgical shops. So you better go to some medical hub and buy it immediately. That will increase your lung capacity. Divya has asked what are symptoms of early signs of asthma. Early signs of asthma, just like you have like the sneezing, coughing, and wheezing also. And finally, when it's severe, it is breathlessness. Bhargavi again asked the same old question: how to reduce asthma? You should always avoid dirt and dust. Should be cleaning. You should home should be clean. You should identify the allergens causing, like the pet animals, dust, food, everything. So you should identify the precipitating factors and you should stay away from those things. Divya, can asthma be cured? Yes, asthma can be cured if you don't have any symptoms in few months. You can stop the medication. If there is any like participant like cold weather or any dust allergy, you can use the inhaler in emergency. So always carry an inhaler in your pocket or in your purse, wallet. So otherwise, you can stop medication if you don't have any episodes of acute asthma. Miss Meenakshi, you're asking how to prevent asthmatic for your child. Your child should identify the allergens like from food, dust, cold weather, any allergy things that is causing him allergy. So if we can recognize the things and if we can avoid such things, he can prevent asthma in his future life and can lead a symptom-free life. Teja is asking question, Covishield or Covaxin, which is the best vaccine? See, both are working well in India. Covishield is a heat-filled vaccine, Covaxin is a live vaccine, and anything you should take. Being an asthmatic patient, you can take anything. Side effects are almost same. Uh, so I advise you to take anything available like Covaxin or Covishield instead of waiting. Meenakshi, uh, what kind of test will my child need to monitor his asthma? For a patient with asthma, you should better always do pulmonary function test called as spirometry. And Lakshmi D is asking Deriphyllin tablets course. How long for asthma patients, sir? Deriphyllin is for it is a bronchodilator, but if you have a breathlessness, it will decrease your breathlessness, but it is not recommended to use for daily use. So when you have acute breathlessness, you can use Deriphyllin tablets. Better you keep asthmatic inhaler instead of using tablets. Always use topical things like rotacaps, inhalers. అది పేషెంట్ క్వశ్చన్ అడుగుతూ చెప్తా ఉండాలి ఇక్కడ నేను. బ్లడ్ ఉందామని నేను ఎక్కడ పెడతాం షుగర్ పెట్టాలి 19 పోయింది వాళ్ళ లంగ్స్ డ్యామేజ్ ఎక్కువ ఉంది తక్కువ ఉంది అంట 7% పోయింది రైట్ అప్పర్ లో కూడా ఆక్సిజన్ 70% పోయింది ఆక్సిజన్ పంపిస్తారు ఇంట్లో బండ పెట్టుకో ఇంట్లో బండ పెట్టుకో
Hello,
బండ
hello.
పెట్టుకో ఏం చేసుకోవాలి ఒక 2 days to COPD, yes. If the if a patient is a smoker, there is a chances of converting an asthma to COPD, which is irreversible. Any medication to stop smoking? Yes, there are medication like Barcinellin. I will type. It is a cannabinoid inhibitor, so it can be used in tablet form to stop smoking. Bronchioles, bronchioles in lungs, they're affected by spasm. Means they will constrict in diameter because of reaction to allergy. Means if a patient of asthma, if he gets exposed to any precipitating factor, like any allergy like dirt and dust, his bronchioles will constrict, causing breathlessness and death of the patient.
Hello. So, sir, I think you just answered the all the questions.
Yeah,
Yeah. So there is no more questions, sir. So thank you so much, sir, for your wonderful session. And if you want to say some final take-home message for our doctors and attendees.
yeah. In this COVID times, always prevention is better than cure. Now situation is worst. So use face mask, sanitizer, and maintain social distance. Stay home and stay safe.
Thank you so much, sir.
Thank you.